When I was toilet training her, she started having really dark nappies. I noticed her wee was quite dark all the time. So I took her just to the normal GP. They then referred us to a paediatrician. She had an ultrasound and they said to me, her kidneys have got lots of blood going on through that, so we need to send you to the specialist nephrology department at the Children's.
And what Allport syndrome means is that you have a change in one of 3 genes. And that means that you make a certain protein in your kidneys a little bit differently than you should do. And when you're born, your kidneys are perfectly normal. The lining of the kidney is perfectly normally formed and your kidneys work beautifully. But over the first few decades of your life, the lining of the kidney gets thinner and more fragile, and gradually your kidneys fail.
We had heard that it can affect the hearing and the sight and everything, and we wanted to try to make some memories for Ellie because we didn't know what to expect. Oh, I'm gonna cry.
Once you've actually got established kidney failure, there's not much that we can change about your progression at that point. But if we pick it up really, really early, when you only have that microscopic amount of blood in your wee, we can start a medication that completely changes the progression of your disease. And by completely change, I mean that we can slow the date at which you will get kidney failure by 10 to 20 years. I lead an exemplar project with the Centre for Health Analytics, and what we are doing is trying to use the vast amount of data on children's health that sits in our electronic medical record to try and find children who are at risk of kidney failure before they or their families or any medical staff involved in their care has any idea that they're at risk of kidney failure.
The purpose of the Centre for Health Analytics is to help the Royal Children's Hospital and the Murdoch Children's Research Institute and the University of Melbourne to really leverage our data assets. Every time there's an interaction in the hospital between a patient and a clinician, there is a whole lot of data that's captured about that. So that's one of our big data assets, but it's not the only one. We also have big data coming off all the medical devices that are now used in healthcare. There's all this value in that data that at the moment is hidden and is really hard to get out. So the role of the Centre for Health Analytics is to help unleash the power of that data. What we do is work with clinicians, with researchers, with administrators across the whole campus. While the Googles and Facebooks of the world have learnt how to sell us things using that data, we're going to take that data and learn how to deliver better, safer and more efficient care.
When kids come to the hospital, maybe they come to the emergency department or they come to an outpatient clinic with asthma or some problem that's got nothing to do with the kidneys, they often have a lot of routine blood tests done and urine tests done. And we're trying to look at those routine tests that were done for completely different reasons and utilise the data in that to find a signature for early development of kidney disease. And so this means that we're reaching out to those families who have never met a kidney doctor before, know nothing whatsoever about kidneys. We are informing them that their child could be at risk of a kidney disease, and we're repeating those tests. And people that have consistent changes, or children that have consistent changes on those results, we're bringing them back to our clinic and we're offering them genetic testing for genetic forms of kidney disease. It's a complete paradigm shift in how healthcare works, and it's about trying to keep children well instead of looking after them when they're sick.
It has been, tough for her. I really don't have words to express how grateful I am for the hospital. We're very, very lucky to have this hospital.
They just really helped me a lot.
So I think for me, what started as a project has completely changed how I'm looking at my role as a doctor. I always saw myself as somebody who looks after sick people. That's what doctors do. Now I see my role as looking for children who are at risk of disease in the future. we're going to keep children well. We're going to keep them at home. We're going to keep them out of the hospital. We're going to reduce the cost of their care. We're going to reduce the healthcare burden for the families. And we're going to make it so that hopefully as children and adolescents that they never experience being sick. We're looking at thousands and thousands of children's records over a decade in order to find these kids. And we simply couldn't do that without an electronic record and without the data analytics team at the Centre for Health Analytics.
I'd like to say a huge thank you to the Foundation and to the supporters for making this big, bold, ambitious investment. This is really an investment for the future. And I'm so grateful that they've been willing to put so much support behind something that is so innovative and is going to so fundamentally change the care of so many kids over so many years to come.